Good morning, Peter Goertz here. What is the day-to-day work as a psychiatrist like? So to back up, the salary is pretty good. In the US, you make about, I'd say ballpark, between $200,000 and $300,000 a year. And the work hours are pretty good for a doctor, usually ballpark 40 hours a week. Some people are on call, a lot of people are not on call. And you get a good amount of vacation. I'd say if you work for an institution, you get 4 to 5 weeks of vacation. And you also get time off for your education, so continuing medical education time. So the lifestyle as a psychiatrist is pretty good. The salary compared to other specialties is not great. For instance, orthopedic surgeons, I'm sure, make a lot more. But overall, the lifestyle is pretty good as a psychiatrist. So for me personally at this point, what I do is I work about 20 hours a week in an outpatient clinic in a hospital. And during that time, I also supervise psychiatrists in training, so residents. And the other time, the other part of the week, I do virtual emergency room consults. I do virtual hospital ward consults throughout the state, actually. And same with the ER consults throughout the state. And in the clinic, due to COVID, I'd say about 40% of the patients want to be seen virtually, but 60% of the patients are actually coming into the clinic now. So that's changed a little bit since COVID has existed, but now more and more patients are coming in and having in-person visits, which in my opinion are preferable. You can physically examine the patient, but the virtual visits also are good, and especially for patients who have a very long commute, like from out of state, the virtual visits can be very good, but it's not quite the same in my opinion. And I treat a variety of patients. There are a variety of diagnoses, and in the ERs, I treat some children. So it's nice for me to get a variety of ages and patients and diagnoses. In the clinic, I treat a lot of older patients. Do psychiatrists do psychotherapy? I myself enjoy psychotherapy, so I still do a good amount of psychotherapy. The visits are scheduled for about half an hour, So in general in the clinic, but for the psychotherapy patients, they schedule visits for 60 minutes, which means that I see the patient for 45 to 50 minutes. And for the half-hour visits, I see the patient for usually around 15 to 20, 25 minutes. And so the short answer is psychiatrists do psychotherapy still. And to me, it's actually a better way of treating the patient, or a nice way of treating the patient, to know the patient's background psychologically, and that way it's also actually easier to prescribe medications for the patients. Do psychiatrists do physical exams? Yes, to an extent. I often listen to the hearts of patients, for instance, patients who are on stimulants, patients with ADHD. So I do physical exams, and if a patient complains of something, I do check them out. I often, if patients are on antipsychotics, for instance, I check them for extrapyramidal symptoms, so for shaking, stiffness. So I check their arms, I check their tongue for tremor. When you check their tongue for tremor, you don't want to have them stick the tongue out. You just have them open the mouth and check for a resting tremor of the tongue. And how frequently to see patients? I see patients, at this point my schedule is very booked, so I see patients generally about every 3 months, but for the patients who have the psychotherapy appointments, I try to see them once a month, which is not a whole lot, but that's all I can do at this point, schedule-wise. And some patients where things are difficult, I try to see them once a month, even if it's not a psychotherapy patient. So Some patients just need to be seen frequently if they're getting to the verge of being acutely suicidal, or if there's something medical going on that you have to follow, lab work, someone being started on Clozaril who needs lab work every week. It's good to see them more frequently initially. So I'd say once a month for someone being treated with Clozaril or being started on Clozaril. And what medicines do I prescribe? Excuse me, a whole variety. Like I've kind of mentioned, anything from stimulants to antipsychotics, antidepressants, anti-anxiety medications. And when I see the patients in the emergency rooms and on the hospital wards, it takes me a ballpark an hour, let's say 45 minutes to an hour and a half to do the consults. Because you do have to, especially in patients with medical issues on hospital wards, you do have to get the background, excuse me again, you do have to get the background and know all the medications, know the medical background. So for that, like I've mentioned in another video, it's good to have a good basic knowledge of internal medicine, some basic knowledge of internal medicine, neurology. And as far as virtual work, you're going to get patients. Like yesterday, I had a patient who was out of state. So I told the patient, I cannot treat you because you're out of state. The legalities are, and in that state, I do not have a medical license. So the legalities are, if a patient is out of state in the US and you do not have a license in the state where the patient is, you cannot treat the patient. So I can treat patients in states where I do have licenses virtually. So that for someone who lives in a neighboring state where I have a license, that makes it a lot easier for them. They don't necessarily have to commute to the clinic. And the technicalities of seeing someone virtually, that can be a little difficult. Technology, someone told me technology is not always perfect, and it can be a real problem sometimes. The patients often have a lot of trouble registering for the virtual appointments, especially the older ones who are not tech savvy. So there are some technical limitations for virtual visits, but overall the virtual visits are going well, and the patients, like I said, tend to like them if they live further away from the clinic. All right, I think that's it, basically. So that's some information about my personal day-to-day work as a psychiatrist. Previously, I've had other jobs. I used to work in a VA clinic where it was just clinic work, and I would supervise residents during that when I was working at the VA clinic. Before that, I worked on a city hospital inpatient ward, a locked ward, and I was doing that all day. And every job is somewhat different, but again, the salary, hours, vacation time, continuing medical education time as a psychiatrist are pretty good. And bottom line, like I've mentioned, the career is fascinating, the topic psychiatry is fascinating, and you meet all kinds of patients from different walks of life. And bottom line, it's fun. Thank you.